16. Anyway, look, I'm going to talk about a particular variety of cancer now this afternoon. I know it might not be the cheeriest of conversations, but the more we talk about this stuff, the better, frankly. And this one doesn't get talked about, which is kind of the point. You ever heard of salivary gland cancer? It's quite rare. And the research on it, frankly, is nowhere near where it ought to be. Going to be talking, hopefully shortly, to an NHS oncologist, Dr. Rob Metcalf, but also by somebody who's had her own experience with salivary gland cancer and is a familiar voice, I hope, to you on BBC Radio Derby, normally talking about her amazing exploits running Derby Theatre, Sarah Brigham. Hi, Sarah.
Hi, Ian. Thanks for having me on.
No, thanks for coming on. And we will talk separately about the 50th anniversary of the theatre, because there's loads going on, isn't there?
There is, yeah. It's a busy old year for us. It's fantastic.
We'll come on to that shortly. But how long ago was it you got... I do remember hearing that you got your diagnosis. And how did you find out? What was your story, and how are you now?
Yeah, sure. So salivary gland cancers, as it says what it does on the tin, really, it can occur in any of the salivary glands. Mine came in my trachea first off, and that was back in 2018. And really, what had happened, to be honest, it was a kind of a slow decline. I realised that I couldn't get up the stairs quite as quick as normally, and I was out of breath, and I've slowly stopped running, and just kind of started to realise that I was a lot more breathless. And I was going back and forth to the doctors, and they were telling me it was asthma for probably about 2 years. And of course it wasn't. And eventually a very brilliant asthma nurse said to me, "Oh, I think this is something a bit weird, so I'm going to send you off for some tests." And so I went off for some tests, and to be honest, having done my own research, I thought, oh, maybe I've got some kind of COPD. I mean, I've never worked down the mines, but I somehow got, when you Google and you come up with all your own diagnosis.
Yeah. So how much of a curveball was hearing the C word?
It was huge. I mean, there's no underestimating how when you get a diagnosis like that, the impact that it has on people. But the thing about salivary gland cancer is not only are you told that you've got cancer, but you've got a rare form of cancer. And so a lot of the doctors and the surgeons that you speak to have never come across it. So for a good 6 months, I was meeting oncologists and surgeons, and they were saying, we don't know what to do. It's a slow, my specific salivary gland cancer is adenoid cystic carcinoma. And it's a slow growing cancer. And so they think I'd had it for probably about 10 years. I've never smoked. It's not caused by any kind of lifestyle decisions. It's just pure bad luck. And so they said, it's slow growing. We think you've probably had it for about 10 years. And by this point, it was really filling up my trachea, and I was breathing out of the tiniest of bits. And so they were like, this is serious. So it was a real blow. And ultimately, the thing about this salivary gland cancer and others that are in this area is they're rare, they're poorly understood, there's a lack of drug therapies, they don't respond to chemotherapy or radiotherapy. Often there's late diagnosis, as there was for me, and there can be a poor prognosis as well. So really, we're raising awareness through the Salivary Gland Cancer UK charity, in clinical and patient communities to kind of drive forward research, information, just so that no one with one of these rare cancers feels alone and feels like I did, which was because at that time there was really nothing. I was talking.
Yeah, all these people saying you've got a rare one, like, aren't I special? Yeah.
Yeah, exactly. So it's not the kind of rare thing. I'd like a rare lottery win, but I don't want.
We'll talk some more about the need to get some attention and some research in a second. But in terms of your prognosis, what was it? You say radio chemo doesn't work. There's not really drug treatments. Was it surgical? And are you fully over it or not?
No, so basically, because of the late diagnosis, surgery wasn't possible. And so I was talking to people on the internet from Japan, America, just going like, what can I do? Because what I was told was, well, there's nothing we can do. You just need to kind of, it'll get you eventually kind of thing. And then I found Salivary Gland Cancer UK charity, and it was an absolute lifesaver. And I found the people connected to it, including Rob Metcalf, who I know is joining us. And then I discovered about a treatment in Germany. So I went to Germany for 6 weeks and had my treatment there. But I had to fundraise to do that. because it wasn't available on the
remember,
NHS. So I did that, and that basically saved my life at that moment in time, which was amazing. I've had a couple of recurrences, and they've been dealt with surgically. And we do. I mean, I describe it as kind of whack-a-mole. I'm very lucky that brilliant Derby Hospital and the brilliant Christie both look after me, and I'm now scanned every 6 months. And when something arrives, we jump on it straight away.
As you said, Dr. Rob Metcalf, who's an NHS oncologist, is with us. Hi, Rob.
Hi there.
I guess I don't need to say why is this particular cancer lacking in love when it comes to research, because if it is rare and unusual, there's a sort of logic there. But how much difference could a bit of attention in some laboratories do?
Yeah, make a huge difference, really. So, I mean, if you think about how do we change things, well, we can only change the treatments we give by knowing more about the disease, studying the biology of the disease. So, what makes this one particular cancer different from all the others? You need to know that so that you know why the treatment for this cancer would be different. So that's your sort of laboratory research. And then on the other side, you have the clinical research, i.e. clinical trials with patients in hospitals and trial units. And you also need that side of research as well. So once you get your discoveries in the lab, you need to translate that to new treatments and then test them against whatever's the current standard, be that sometimes that is no treatment if there is no standard treatment, and sometimes there is a current best practice. But that's how we change things.
What about the treatment that Sarah went for in Germany? Is that just something that's not available because of resources here, or is it not trialled here?
Combination of things, really. So it's in part it's resources. So it's a very specific subtype of radiation that Sarah's talking about. So in the UK we don't have access through the NHS to that. So I think Heidelberg in Germany is a sort of high throughput centre that takes patients from all over Europe. We were in that position until recently with protons. So proton therapy was the same. We used to send patients. The NHS then did commission that though, and we're sending patients for proton therapy, across Europe or even across the world. But now we have our own proton units. There's still an evidence gap really around this other type of radiation that I was describing. So it probably isn't as simple as us just building the centres and then we've got it there. We'd have to also do the trials, I think.
I'm aware that it's possible you could be listening to this conversation now and what Sarah had to say about her story just now, and anyone, frankly, who sometimes gets a bit out of breath or has a bit of a lingering cough might be thinking, blimey, have I got that?
Sarah, do you want to talk to that?
Just all I would say is if you've got a cough for more than a few weeks, go to your doctor, and if it doesn't go away, keep persisting with this. But I think what Salivary Gland Cancer UK charity's doing is it's trying to educate doctors as well, because otherwise I present as a very fit, healthy, at that time I was only 40, so because it's so rare, the doctor didn't know how to identify this. So it's your own body, you have to push you, and I think the challenges with salivary gland cancer patients, and Rob will know this very well because he comes to our now meetings, because that's the other great thing that the charity's done, is that we set up now meetings for us to come together. You become your own advocate. You have to become your own advocate. You have to know your own research, and you have to push forward. So that's what I would say.
Rob, is there more that could be done to make GPs consider it?
Well, I would just to reinforce the point I think that Sarah made, which is any new persistent or progressive unexplained symptoms, you need a good explanation. The challenge, as that we've been describing, is it's rare, so it's not the first thing that comes to people's minds, and often this particular cancer is really slowly progressive, so it fools people into thinking there's nothing serious. But I think the key message for patients or people who are otherwise well without a diagnosis, and for healthcare professionals, is just making sure that new unexplained symptoms don't get left.
Really good to talk to you both. Rob, thank you for your time.
Thank you very much. Thanks,
Dr.
Sarah.
Rob Metcalf. Good to see you, Sarah, as always.
Thanks very much. And if anyone wants to go on the Salivary Gland Cancer UK website, you can donate there.
I was about to say, go look up Salivary Gland Cancer UK. Love to see you. Sarah Brigham, Dr. Rob Metcalf, BBC.